advice would be that there is an ever-growing need for qualified health informatics professionals. We are in a modern time where there is an abundance, if not overabundance, of information and data, and yet we still have not fine-tuned our ability to leverage this information and data appropriately. So if you're kind of someone who's excited about this challenge of not just creating more data, but better quality data, then really who wants to be a part of that solution? An informatics career would be incredibly meaningful. As a diverse field, a person with informatics and public health can look and be situated in many different places. There's a range of opportunities for someone with that informatics background. This can be in governmental agencies, so local or state health departments, healthcare organizations, or even private companies who are looking to develop and launch new technologies around health and wellness. And all of these places are really going to be looking for individuals with skills to analyze, visualize, communicate data in the way that will inform different programs, policies, or products. And I think this typically involves getting to have fun playing with data, but then also working in dynamic teams so that data can be most effectively translated into action. Yeah, the pandemic has been an exemplary situation where we need to make decisions and make decisions in this rapidly changing context, sometimes with incomplete information. And informatics is exactly the science that provides us the tools to do this by leveraging data and information as best we can so that we're making the best decisions we can in the context of that uncertainty. So for example, we have seen the use of simulation modeling throughout the pandemic. So we're using what knowledge we have, what data we have, to help us understand what might COVID cases look like, hospitalization, utilization, deaths. What is that going to look like across various geographies under different scenarios? So we look at like, okay, well, what if we don't do anything and we just kind of try to reach herd immunity? Or what's going to happen if we try to achieve greater adherence to wearing face masks? Or what if we open elementary schools up, right? And so these models, they're not perfect, but they certainly give us something more than just our own hunch or intuition alone that we can use to inform those policy decisions. So I have a master's and a doctorate in the public health field, both with a focus on community and behavioral health. My passion, though, has really been to make tools from informatics and other data and technology-oriented sciences accessible to communities, and really to empower community leaders and decision makers to identify, implement, and evaluate the interventions and policies that are really aligned with their needs and strengths and preferences. And I've done this working in a range of diverse communities and really across the lifespan. So for example, right now I'm working with a group of high school students from a rural community here in North Carolina, where we've been leveraging data and technology. And the high school students are really driving what we're working on. We started with physical activity and more recently working more on emotional and mental wellness, which has been so incredibly important during the pandemic.